You'll be like,
Hello, everyone. Today, welcome to our series of Pain to Power. Today's topic is managing endometriosis uh, pain and how physiotherapy can help you. So, let's get started. Before I get started with endometriosis, I will give you a bit of my background. I'm a women health physio and women health and musculoskeletal physio. How I got into women health was more because of endometriosis. I have a personal reason attached to uh, exploring this beautiful area because I got diagnosed with endometriosis myself, and I have to uh, I have to fight for this diagnosis, I would say. So now, being through that journey, and which took 8 to 10 years nearly to get a diagnosis and validation of my pain, helped me to get out of this self doubt that, oh, I'm not making it. It's real. It did help me a lot to make informed decisions about my life and my work and my day to day routine as well. So let's get started. And I'm here to help you. If you have any questions, please send through the chat, and I will try to answer those questions as I go towards the end of the presentation. What is endometriosis? Endometriosis, when we talk about endometriosis, it's important to understand this because sometimes we get confused between what is normal endometrial lining and what is endometriosis. These are two separate things. Endometriosis is the presence of endometrial tissue outside the endometrial cavity. Most commonly, it affects ovaries, which could be unilateral or bilateral, or all, and it goes beyond to. It can be present anywhere in on any um tissue in the pelvic, not just in the pelvic area, or maybe a bit more distant as well. So what happens is during uh, during periods when we are menstruating, due to hormonal changes, wherever we have these endometriosis, endometriotic lesions or endometrial tissues sitting outside the uterus, we get pain, we get symptoms wherever those lesions are attached to. As I said earlier, it's important to understand what is normal endometrium. Here we are not talking about uterus. We are talking, endometrium is the lining of uterus, if you see here, which is normal lining. And when we get periods, this lining goes through changes. And when we during our cycle, this lining goes through changes. And when we get our periods, this sheds off, and that's our blood and flow which we are getting through the periods. But when we are talking about endometriosis, it's completely different entity. It is a similar kind of tissue which is not inside the uterus, which is outside the one, either on the one. If you see this picture, you can see these lesions which are growing more on fallopian tubes, ovaries here, and then on our tissues outside the uterus, any ligament supporting the uterus. It can be in between the bowel and bladder uh, uh, linings as well. So, moving to the next slide. What are I hope you understood what endometriosis is. It's a little complex. I will talk about it, why it's important to understand it, because that is one of the reason why you get a delayed diagnosis. So now, what are the symptoms associated with endometriosis? You can have a long-standing chronic pelvic pain. You can have exponentially painful periods, which sometimes make you feel like you're passing out, which leads you to miss your work days or your school or your uni days. So I don't want to say that everyone who gets those symptoms has endometriosis, but this endometriosis can be one of the cause. Then, if you have pain during intercourse, we are not, then there can be multiple reasons to have pain during intercourse, but endometriosis can be one of those. Uh, we are talking about deep seated pain, and yes, pain with intercourse can have a background of endometriosis. One of reason. Infertility, if anyone is having difficulty getting falling pregnant, and uh, in this population, I think, because you're not getting pregnant, and when you go through further investigations like IVF and uh, other to get assistance to fall pregnant, people do find endometriosis early. Then you can get a bloating and fatigue, unresolving, unstoppable tiredness as a what's this called, the secondary symptom. If you have pain with urination or bowel movement, endometriosis can be one of the reason. If you ever had incomplete voiding, like you pass the urine and but you don't end up emptying your bladder completely and you have to go again and again, or if you have similar issue with passing the motion while defecating, so there can be endometriosis behind it, one of the reasons. And then this other symptoms can vary where these lesions are uh, situated, whether it's beyond the pelvic area. You can find endometriosis lesions in diaphragm as well. You can find you can have dull low CT backache if those lesions are more on the nerves. So these lesions can show up anywhere in the pelvic area or around the tissue. I don't know if it's about, I didn't get the time to read this research, but I was reading about that someone had endometriotic lesion in the shoulder, but I haven't, which was a surprise for me as well, but I haven't had a time to go through that article and do a further research, not find any validated documentation for that. But what I'm trying to explain here is, I know that these are the main symptoms which uh, we can think, if you have any of these, we can think about, oh, it be endometriosis leading to these symptoms. So coming next to is, now it brings us to this question is, why is it often missed? With my own presentation and my own journey, it took me nearly 8 to 10 years to get a clear diagnosis of endometriosis. The reason behind why it gets missed is because symptoms can overlap with other conditions and it takes time to rule out the other stuff. And in being a woman, it's sometimes we normalize that pain, having a pain during periods is normal. When you're going through pregnancy or postnatal era, it's normal to have pain. And it's more of a normalization, this normalization of pain, maybe from our elders or from healthcare providers, sometimes we kind of like get this idea of normalization of pain, and we think, okay, it's okay to have these symptoms. That can lead to delayed diagnosis, and we delay ourselves, not seeking help on time. We try to do other remedies which don't work, and that's when we start seeking help. It's already been like 5, 6 years or 7 years till we go back to seek help. Another, if you have gone there on time with endometriosis, there was very less research. There were very not much. There was not many studies. This is one area which needs a lot of clinical resources to help clients. So the good news is, in the last 4 years, a lot of attention. Endometriosis has got a lot of attention. And earlier there was only one diagnostic tool which was given as an option, which was laparoscopic, in your pelvic area. But now, with the research and advancement, we have another test which can help diagnose it with quicker and in a less invasive way. So these are a few things which can lead to missing the diagnosis. And another thing is, if the health provider you are seeing and trusting, they are not well invested into women's health area. If they don't know endometriosis a lot, it is hard to get the right help in a timely manner. So basically, it's more important to get understanding it and putting your voice forward and getting the right diagnosis to get the right treatment. How it affects our day-to-day life? Yes, it does affect your work. It can impact our family life. You have kids. You're a mom who wants to be active, play with the kids. But you're in pain most of the time. You don't have that energy and you don't have that flow. And then same thing for work. It's not always that work is burning you out. It could be something going inside your body which is getting it hard for you to accomplish the dreams, what you want to do. You know that somewhere inside you have that capability and capacity, but things get so slow and your body can't move forward at the same pace as your thoughts move forward. Relationships, yes, it can impact your relationships. You need to have a very good, strong partner who stays on board till you. I'm going to pause this for a moment. I think we are having a technical issue somewhere. Let me resolve it. Sorry for the interruption. I think there is some issue if there is cracking, the voice is breaking. In case there is a problem with the sound issue, I will be recording this and putting it for viewing later. So where I was. So if you are having any relationship difficulties due to these symptoms, it is good idea to seek help at the right time. You need to have a very supportive partner. It's not easy to navigate endometriosis. Once you know that what you have, it gives validation to your pain, and then you can, being together as with your partner, you can make those decisions how you are going to navigate this your endometriosis journey. It does affect your mental health. You are strong, you're a very engaging person. All of a sudden, things are not going right track. You feel really deconditioned, demotivated, pain is a barrier, and you have all those other symptoms on board. As I said earlier, having when you have a pelvic pain, it can make it hard to be it can affect your intimacy, and it can break relations. So it can affect your dynamics of family relations and your personal well-being as well. So where do we start? Where do we look for the help? These are the people you need to have in your team when you are managing endometriosis. You need to have a good GP on your side with a special interest in women health who can help you, make you understand styles and medications or treatments, and support you throughout your endometriosis journey. Your GP can organize referral to gynecologist who has a special expertise of dealing with endometriosis. This is important. Gynecologists have specializations as you need to find a GP who is expert in dealing with endometriosis and it has very good hand in excisional and surgeries, which we are going to talk about. Yeah? You need to find a good pelvic health physiotherapist who can work along with you, getting you good education, making you understand how you can self-manage your pain after your pelvic health physio has helped you to work on your pelvic floor, exercises, and being there to give a direction when to seek help from gynecologist and when to have other options on board if you need any physical systems like nutritionist, acupuncturist, good massage therapist. It's all these four pillars and all these people in this team need to be talking to each other, working together to provide a better holistic care. As I mentioned before, earlier in the delay in getting a diagnosis for endometriosis, the option was laparoscopic examination. But now there is ultrasound which can really differentiate between endometrial tissues. This ultrasound is very different to your usual ultrasound, usual vaginal ultrasound, which is more for the lining of your uterus. This GI scan is a deep infiltrating endometriosis scan. People who do the scan and report this scan, they are highly specialized, and every ultrasound radiology center can't GI scans. Make sure when you book your scans, a list of good radiological places where you can refer you to get you this scan done, and also your GPs if you're not seeing a gynecologist. But my personal experience, this was a life-changing scan for me, and this scan did help me to get stamp on my diagnosis, which I was putting forward for years and years. And because it's non-invasive, it's easier to get it done, and you don't have to go under anesthesia and other stuff. And it's only the thing is sometimes it's hard if you're having grade 1 or early stage of endometriosis. It is hard to break those lesions. Another I missed one thing here is one diagnostic test is sometimes gynecologists can specialists can refer you for MRI scans as well. It can be the lesions as well, but not always. It varies from case to case. Scoping examination is when gynecologists would say, let put the camera in, and then we do look into your pelvic area and see if there are lesions. And if they find the lesions, they do offer exercise at the same time. It becomes an examination process and sometimes a procedure as well. But it is based on discussion between your gynecologist and you. Now, coming to treatment options, your GP might or your gynecologist might recommend you to try some hormonal tablets. Basically, what we are aiming here is to stop this growth, or there is one specific hormone called estrogen, as per research. Estrogen is the one which is like food for the growth of these tissues or lesions. With medications, when we're talking about these hormonal medications, what we are aiming is it's kind of like finding a sweet spot where we increase the estrogen levels and support the other hormones. And what it does with those medications, it's kind of like stops or slows down the growth of these lesions, and you stop getting that flare up of pain and during your periods or other symptoms as well. If medications work, you don't have to go ahead with surgery. If your symptoms stabilize, once you reach your menopause and your period stop, you don't have estrogen overload now, and your symptoms get better itself. Other option, as I mentioned before, is surgery, which can be excisional surgery of taking this lesion, excising these lesions out. And other option, if it's very depending on how extensive your this endometriosis is, having a full hysterectomy. It depends on where you are. That is something your gynecologist will discuss with you. What are the options? And you might end up needing full hysterectomy, and maybe they can leave the ovaries if they are not impacted, and you can still have menopause because your hormones will be there, but then it's more of like it varies from case scenario to case scenario. Other thing is physiotherapy. Physiotherapy is another option where